So welcome everybody to the second research seminar of the term at the Institute for Future Studies. I'm very happy to have Professor Daniel Wikler here. Dan is a professor of ethics and population health at Harvard at the School of Public Health.
Yeah.
And has written a vast number of papers in medical ethics broadly, and also one of the co-authors of I think the dominant book in medical ethics, From Chance to Choice, which I can recommend you to read if you want to have a good coverage of medical ethics. And you got your PhD quite a while ago, 76, I think.
I know how old I am. Thank you. Yeah.
University of California,
yes,
LA.
Yes.
And you wrote of something that was maybe not so much medical ethics in those days, I think.
In those days I was working on some natural language semantics, so it was somewhere between philosophy and linguistics and mathematics.
Exactly. So, and you're here today to give us a talk about e-cigarettes, but you're also here because we're going to have the first workshop today in the International Panel of Social Progress, where you are one of the coordinating lead authors, a great project. But I'm very happy to hear your talk today, so very welcome.
Thank you, Gustaf. Thank you very much, and thank you all for coming. And I really look forward to this discussion because I know I'm going to learn more than you will. Let me begin with some preliminaries. First of all, with this talk, since I came here to Stockholm thanks to this other project that Gustaf is helping to run, and this is a kind of a nice add-on. There was no particular agenda that was handed to me and said, so you have to talk on this or we have a conference on that. So the question was, what did I want to talk about? Well, I said, depending on the audience and what their interests are, I have some talks that I usually give to philosophical audiences or people who have mostly academic and theoretical interests. But at the moment, I happen to be all pumped up about something else. And it's actually rather shallow and thin on the intellectual side. But nevertheless, it's what I dream about. And so my hosts were kind enough to say, well, as long as you're all hopped up on that, go ahead, let's talk about that. So that's what today is. And what I'm going to be talking about is something that should, the credit for it, if credit is due at all, has to be widely shared. My immediate co-conspirators are 2 or 3 faculty at Harvard. In particular, Vaughn Rees, who is the director of our Global Tobacco Control Program, and Stefan Verjre, who is a number cruncher epidemiologist who had been with Gates and is now with us, does global burden of disease work. And there's some others. Professor Stephen Marks is an authority on international law and human rights law and so on, and he's going to play a crucial role too. But if we go further back, we can find many, if not most, maybe even all, for all I know, of these ideas in the writings of still others back in the 1990s. The person who we recently discovered is named Walt Stumner. He's a professor at Washington University in St. Louis and published very illuminating and, to our minds, far-seeing papers that didn't seem to get much take-up. Now, does that mean that they didn't deserve to be noticed, or it was just one of these unjust outcomes that befall excellent proposals? Well, we prefer to think the latter. But anyway, I want to mention him. And another prominent person is Kenneth Griffin, who's at the University of Michigan. And perhaps there are people in Sweden who have said the same thing. So what I should also emphasize that along with my enthusiasm comes novelty. This is a presentation about tobacco control or tobacco amelioration, harm reduction intervention. I've thought about tobacco for a long time, but I'm no tobacco control expert and don't have the scientific background that my colleagues I'm working with have. And so what you're going to hear is the result of a lot of enthusiasm, a little bit of knowledge, and some preposterously ambitious hopes. Now, I'm especially delighted to be giving this talk here in Sweden because this is snoozland. And one big question, well, several big questions about snooze. One is whether you're blessed or damned for having them. And secondly, if you are blessed, whether they're specific to Sweden, whether they're something that can help Swedes, but really not very many other people. And maybe in the conversation, you can illuminate that question for us. Now, I'm going to be talking about a proposal, or be launching a proposal. Actually, I want to recruit you to as partners in it. I'll be talking about a proposal to ameliorate the global burden of disease attributable to smoking by a nicotine maintenance program. And this means trying to get people who smoke to switch to some kind of vehicle that will get nicotine into their system without burning tobacco. That's basically how it works. Now, the product that comes to mind for people outside of Sweden is these days is e-cigarettes, but I happen to I carry my little product case with me. Yeah, I get a cut off of every one of these. No, actually I don't. Not yet anyway. So this thing is called Arrows. And I do carry them around with me. I have a particular fascination with this product for a reason I'll tell you. So it looks like a cigarette. And I'm told that it feels like a cigarette. This is plastic actually. And in here is a device. I'm not a user. This thing allows you to snip the ends, and then you take a puff like you do with a cigarette, and you get a hit. And so it's a vapor vehicle for delivering nicotine through a vapor. And these things have been around for at least a dozen years. And the reason I know about them is that my wife is an addict of these things. She's a fellow philosopher and developed a habit of smoking while she was doing philosophy, and she claims that they're now completely bound up in each other. No philosophy is going to come out of her unless she's got something going. At one point, she realized she had to get off cigarettes, and she got on the internet and looked for a substitute and found this thing, which was invented by a very odd, not terribly well-educated engineer, I think, on the West Coast. And he said he invented it because he was in the same pickles. He needed something. So she tried one of these and hasn't touched a cigarette in 11 years. So here in the house, I had a living example of somebody who seems to, I have no idea what she's imbibing, along with the nicotine. God, I'm not sure I want to know. But it looks as though she has escaped the perils of tobacco and, hasn't had any relapse at all. So if everybody's like her, this is going to work great. I'm not sure I'm entitled to assume that. But still, it's given this vivid example, as close to me as anybody, gave me some fascination when I first began to hear proposals of this sort. Now, the idea of promoting an addicting mechanism, of actually trying to convince people to try to use something that's going to get this most addictive of substances, nicotine, into the system, is anathema to much of the tobacco control community. May I ask how many people here would say that that this is the community that they work in? Okay, so you can contradict me or support me in this, but and I don't know, maybe in Sweden, well, it may be different, although I know the community is split here. But there's no other issue that I'm aware of that has driven a deeper, caused a greater split among opinion leaders in any public health field than this. If the abstract that was on the Institute's website about this talk mentioned that last year the Director General of WHO received 2 remarkable letters, both very well done, I thought. One of which applauded WHO's insistence that e-cigarettes and other nicotine delivery devices that don't involve tobacco be regulated along with and on a par with cigarettes. and the other which condemned it in the strongest terms. And if you look at the people who signed these two letters, these are people that you have to take seriously. And I have sympathies with the views that are expressed by both sides, so I feel the split myself. And I'll give a little bit more personal information. My father, Abraham Wikler, was an early addiction researcher. You can Google him and find out about his theories. And he died of nicotine addiction, so it hit home. Now, as it happens, he was one of his trainees was a psychiatrist named Marie Neiswander, and those of you who are in the addiction field will know her name. She and her husband Vincent Dole were the people who put methadone maintenance on the map, and the accounts of the history of methadone maintenance almost always go back to their landmark 1965 paper. And Dad approved of her while she was his trainee, but when she came up with this idea, he thought that was awful. So, well, maybe it would have saved him if it had come into play. So let me just begin with presentation of the proposal. Then I'll talk a bit about the justification and some of the arguments pro and con. And I'm going to speak just briefly about some much larger themes that tie into this that I think are important and relevant, and then have plenty of time for discussion. So if you don't mind a kind of operatic overture. In the 1930s, the eminent physicist Leo Szilard wrote to Einstein. And he said, if you write a letter to President Roosevelt saying that an atomic bomb might be achievable, might be able to build one, and by the way, the Nazis are already on the case, then the question of whether to proceed with this is going to change from whether to how. And Einstein did, and that's what happened. Now, this is not about creating another atomic bomb, but it's about what happens when you focus, as one should, on what's at stake in a big project like that. Namely, it was supposed to be defeating the Nazis and turned into something else. Similarly, when President Kennedy announced that we were going to put a man on the moon, everything switched from whether to how, and actually we got there. Now, of course, there have been any number of statements like that. President Nixon announced that we were going to find a cure for cancer, and that hasn't happened yet. So simply announcing you're going to do it doesn't make it happen, but it does throw a lot of switches from the negative to the positive, or opens gateways, and things really do happen. So that's the spirit in which I want to sell this idea. Basically, what we propose to do is to begin from a global burden of disease perspective. For those of you who aren't in the health field, and I guess some of you are not, many, maybe perhaps most, global burden of disease is the world's biggest global health project. It's a mammoth exercise in descriptive epidemiology that aims to account for every death in the world and a lot of the disability by cause in every single country, and to do this continuously in the future. So it just uses up gigantic amounts of data and has very, very intricate ways to spin it and analyze it. And the output is now becoming something like a common currency in global health. It's used to chart progress, to make comparisons, and to some extent to try to preview the potential impact of different interventions. So there are fierce opponents of it too for a variety of reasons. But what the great contribution to my mind is correcting for what I think is a unfortunate defect in the moral vision of people who are in the individuals of the species Homo sapiens. This is a kind of just so story, but bear with me. As we evolved, we presumably had to contend with a number of factors that were threats to our survival, occasionally a few opportunities we had to help others. How many of those? Well, count on two hands. When it gets much higher than that, they tend to blur into each other. And when you start adding zeros, they become almost indistinguishable. So Stalin is supposed to have said that one man's death is a tragedy, a million men's deaths is a statistic. And I don't know if Stalin actually said that, but that has a lot of truth to it. If somebody on the street is told that a terrible accident has happened in Sri Lanka or Laos, that a train full of school children derailed on a bridge and there were 700 deaths, well, this person's going to say, oh, that's just awful. Suppose you increase it to 900. Now that's 200 extra deaths, each of which is a tragedy. The response will be identical in terms of the way the experience of the person who is responding, and also in the kind of judgment that's, or sentiment that's expressed. And we could give other instances in which adding zeros doesn't change a thing either. And that's perfectly understandable. We're just not made to think that way. But in fact, when you add a zero, it's 10 times worse than before. So we don't have our responses to large numbers of tragedies isn't proportionate. And if one thing that happens, one reason why I feel at home in a school of public health, which is where I teach, is that there is a strong effort on the part of everybody there to correct for this failure of vision and to try to see the world, you know, in proper proportion, so to speak, so that we don't make the same judgment about very, very different levels of tragedy. Now, with all that said, and it's a lot of huffing and puffing, let me get straight to the proposal here. First thing to do is to look at the total amount of misery, deprivation, premature death that's caused by smoking, which is just staggering. And I'll talk a little bit more about that in a moment. So if we could do something about this, it would be a fantastic thing. So what do we propose to do? We have several proposals, and we're offering them as a package. And that's a very important part of this for reasons I'll get to. First thing is this. Try to take things like this. This is not an e-cigarette. Also take e-cigarettes. Maybe take snus, although doesn't deliver by vapor, which is an important question here. And anything else that comes to mind, and try to improve these, and improve them in two ways. First of all, for many of these devices, what seems to be limiting their uptake is a lack of nicotine in what it delivers to the user. The e-cigarettes deliver a lot of nicotine, but apparently not as much as a lot of smokers would need to have delivered in order to switch to them voluntarily. So it means pumping up these products, which already means that by that proposal, we've lost a lot of our audience if we're talking to tobacco control people. So making them stronger. And the second thing is making them more varied. I'm not a chemist, but the chemists I talk to say that different smokers want different things from their tobacco. And the tobacco companies know this very well, so they have many, many different varieties, and they put different kinds of chemicals, different balances of chemicals in their cigarettes. And a cigarette that is not going to be pleasing to one smoker will be just the thing for another. Which means that if you had only one kind of nicotine delivery device, it might satisfy a lot of people, but it also may fail to interest a lot of others. So what our proposal is to put resources into developing a variety of these things. And the goal is, to be simply stated, we want to be able to say to every smoker that we have a variety of nicotine delivery devices here. At least one of them will be as satisfying to you as cigarettes are now. So when we can say that with the devices to back us up, we'll have reached that goal. So that's goal number one, is improve these devices. The second thing is to develop an instructional intervention. Now, this is a contentious point. The question is, how much instruction does one need to be able to get the satisfaction that one gets from cigarettes from these devices? And the opinion ranges from none at all to very extensive. My wife never got a lesson from anybody. She took a puff and bang. But she's tried to share it with some other smokers and found that they take one. It's too strong. They put it away, never pick it up again. If she talks to them for a while, things can be different. So, and that's just with this one. With Ecigs, it's much more complicated. And I don't know about with snus. In any case, we have people at Harvard School of Public Health who spend all of their time on health communication. Their job is to explain to people who are at one state of knowledge, low, how to get to a higher state of knowledge so that they'll be more likely to make good use of health information, and that's what we propose to do with this. So what we want to achieve is, once we have this supply of nicotine delivery devices, to have this instructional intervention that can be counted on to convince every smoker to give it a good try. So the third plank is this. We want to call on every government to offer every smoker in their country a 180-day free supply of whatever device turns out to be the one for them. Now, this raises some problems. A big one is that people will be very tempted to sell these things, so we'll have a huge black market. And we haven't solved that one yet, and maybe 180 isn't the right number. But anyway, a good supply. And the fourth plank here, in this part of the proposal, is a pledge by that government that in the future, these devices, whatever they need to satisfy their craving, will always be cheaper than cigarettes are. So there'll be a net saving. So if we can put this in pictorial terms, we don't want to create a gradient that asks anything of the smoker. We don't want the smoker to have to put up with anything. We want the device to be just as satisfying to the smoker who's addicted to nicotine as cigarettes are, and the price to be lower. So unless there's something, if we can figure out a way to make the other benefits that seem to come with holding this little thing possible with a new device like this does by looking like a cigarette, then that's fine too. Essentially, if we reach our other goals, cigarette smokers will give up nothing at all by switching. And that's what we're after. We're certainly not asking them to quit. In fact, we only mention quitting. So this is how this proposal is akin to methadone maintenance for heroin. It is a open-ended maintenance proposal. Now, as I'll mention a little bit later, there are proposals to tilt it's not a playing field, what is it? Anyway, to create an incline in such a way that you can accelerate uptake of these things. And the place where this is under development is, amazingly enough, the Food and Drug Administration in the United States. And I'll mention their big idea, which is a sort of great idea, if it'll ever happen. But our proposal is just this, at least for the time being. Now, that's what we want to do by way of introducing this alternative to smoking. But there are two more parts. One of them is we regard this as complementary to smoking cessation programs. So just about everything that's in the Framework Convention for Tobacco Control, that the only treaty that WHO ever tried to broker, which it has done very successfully, everything would remain. There would not be prohibitions on the promotion of e-cigarettes, however, or alternative nicotine devices, which is the direction it's going in. So we see this as complementary to smoking cessation. It's just not that. It's something else. And the last part, and this is a part that is not going to be accepted by everybody, is that just as we're pushing these things on smokers, our proposal is to try to do everything we can to prevent them from getting into the hands of people who are not presently addicted to cigarettes. Mostly this means young people. So the first thing is no bubblegum flavor or candy flavored E-cigs, which is something that we have in the States now. No creating these glamorous looking vaping lounges where kids can go and feel cool, and basically no advertising in media that kids come across, but more stringent than that. Now, basically what we're asking for is a kind of medicalization of these products so that they'll be seen as a remedy for a medical problem that a smoker has, namely being addicted to nicotine. And the packaging should reflect that. We're not asking that these be limited to people who get a doctor's prescription, because that would almost certainly mean that they wouldn't be used. They would be promoted. In fact, we want them to be heavily promoted to people who are addicted to nicotine and who smoke. Now, how to achieve the goal of promoting it to them and keeping it away from people who are not addicted, that's quite a trick. It can't be done perfectly, and it's a compromise. It's a potential problem with the proposal, but anyway, that's what it is. So that's the proposal. Now, why are we beating our drum about this, especially given that other people have already had these ideas? It's not because we think that people will listen to us and they didn't listen to them, but because we think we're at a moment in the story of tobacco control, one that's had fantastic victories that were unimaginable only a few years ago. We're at a moment where there's, as I mentioned before, a deep, deep split. There's name calling and distrust. I am on a listserv that for people who are strong advocates of E-cigs, and the venom that pours out daily on those dispatches toward all kinds of people who I revere in tobacco control is really amazing. And similar sentiments are expressed not in visible form, but in closed, in conversation on the other side. So this isn't good. The enemy is cigarettes, and to have the people who are trying to free the world from the burden of disease that flows from smoking have this community split like this is a very, very bad thing. What we hope might be achievable is a reconciliation, and our proposal is crafted to try to achieve that, which is why it's a kind of a bit of a jumble of different ideas, but also why it includes something that is quite offensive to many people who we hope to win as converts, namely the strong regulation of these devices, trying to keep them out of the hands of young people, because some of those young people might turn to tobacco if they don't have this to turn to. There's some evidence that, the last year, the use of these things tripled, and among young people, and the smoking rates for initiation of smoking actually went down. So on its face, it looks as though some young people are going to be rescued from a lifetime of addiction to tobacco because these things are available. And how could we be opposed to that? Good question. But we think it's essential to put it in there to win the allegiance of at least half of the people who we hope to convince. So if we were able to convince both sides of this controversy that there's more to be gained from their point of view by signing on than by remaining apart, then maybe we could achieve this kind of unanimity in the field. And with that kind of unanimity, and if we get the confirmation of the figures for reduction of burden to disease that we now have in rough form, I'll mention those in a minute, then our hope is grandly ambitious hope, is that we could convince the important agencies in the United States, the CDC, and if the election goes the right way, the White House, and appeal to similar agencies elsewhere, Sweden and so on. And then finally, convince the World Health Organization to build this into the Framework Convention. And if it had the results that we're talking about, then we think, looking back after we'd achieved all these successes, this would be counted as one of the glorious chapters of public health. So that's why we're all pumped up about it. So let me give you some numbers and explain why we are entertaining such fantasies. First of all, just a few quick numbers about tobacco for those of you who are not in this field. Smoking is either the number 1 or number 2 risk factor for premature death, and among the top 5 risk factors for reduced overall health in a lifetime of anything. So it's just a fantastic killer and slayer. The latest figures from the Global Burden of Disease 2010 survey are that there are 5.7 million deaths per year due to tobacco use. 6.9% of all years of life lost are due to tobacco, and 5.5% of all healthy life lost. That's looking at not only at mortality but also at disease. WHO has estimated that if we don't change what we're doing now, between now and the year 2100, by the end of the century, the number of excess premature deaths will be 1 billion. That's a big number. Add up all the deaths from all the wars of the 20th century and see which one is bigger. 1 billion is just a really big number. The number of people who die every year is about 50 million, I think. So it's a huge percentage of the people who died needlessly young and who don't enjoy the health that they could. So why is it that we're not all agitated about it all the time? If you look in the news media, there's no problem getting attention to Ebola or Zika, just as there's no problem having AIDS be the thing that everybody thought about for so long. By comparison, this is a vastly bigger thing, but it's constant. So we know that things that don't change after a while lose their visibility. So it's like a combined AIDS, Ebola, Zika, whatever else you like, epidemic that has raged out of control at mammoth levels unceasingly for decade after decade, and it's still going on. Now, the fact that in Sweden you had marvelous success in reducing the use of tobacco, and that we have in the United States, it may have contributed to this kind of blindness, because the people who write about this tend to be in countries like ours. Sadly, the number of smokers continues to rise in the world. The smoking rates go down, but because of population growth, more people smoke each year than smoked the year before. So it's not going away. It's getting steadily worse, and it's going to get worse still. 62% of men in Indonesia smoke. 1.5 million Chinese die every year from tobacco-related causes. It's just a fantastic slayer. So the only silver lining to this, and it's not much, is the potential that could be achieved if we could do something about this. The potential reduction in burden of disease, which is this huge quantity that we can't get our minds around very easily. Of course, it all depends on many factors that could get in the way. And I should be upfront about these. It's not as if we have a formula that's going to guarantee that we achieve an abolition of smoking and a complete freedom from all that burden that I just sketched. It depends on how many people actually do switch, obviously. And that depends on many things. We have to actually achieve the success that we hope for with these devices. And the people I talk to are pretty optimistic about that. But there's division over how close we are, and division over certain very technical matters that would, in the eyes of pessimists, pour cold water on a lot of our hopes if things don't get markedly better. So I don't want to pretend that we have solved that. There's one big problem with the use of these devices is that although they can be used as an alternative to smoking, they can also be used as something that makes smoking easier to continue. The guy who invented these things is at least for a while was happy to talk, to just have conversations. So I tried to recruit him to to come over to the good side, and I said, just imagine what it would be like if you worked with us at Harvard School of Public Health, and because no one's ever heard of these, just advertised on the internet. So imagine that you were discussed in newspapers around the world. And he kind of liked that idea. But then he said, look, let me just make one thing clear to you. If I were to play ball with you, I don't want you or anybody putting any restrictions on who I can market my products to. Okay, he means something by this. Who is he talking about? Well, in a second I realized he sells to people who smoke and who like to smoke, but can't smoke at work, or they fly and they can't smoke on an airplane or something like that. And they buy his device because they can get past their nicotine urge, and so they can go home and then smoke. And if it's possible that some of these people would give up cigarettes if they didn't have a crutch like this. So that means that along with the freedom from the burden of tobacco that might be achievable with these things, we're actually going to extend and exacerbate the burden because some people who might have given up cigarettes won't now. And there's nothing we can do about that. So that's an offset. We have to figure out how big a problem that's going to be, and also if there's any way of staving it off. And also there's questions about the safety of these devices. As I mentioned, I have no idea what's in here. And my wife still seems healthy, but it could happen anytime. And with the e-cig market, as is often said, is a wild west. There's very little regulation, and God only knows what you're inhaling with those vapors. They come out of China, where a lot of strange things happen. So when people say that that these alternate devices are going to be a lot safer than cigarettes, they're expressing a hope. Now, that said, there are some who insist that the net risk is going to be zero, that nicotine is not inherently more dangerous to the average person than caffeine. Some say this. Other people are very worried. And especially with certain risk groups, people with a cardiovascular problem, people, and maybe pregnant women, should be kept away from this until we have much more information. So we're assuming that there's at least a 95% reduction in risk, and we're imagining what the reduction overall would be, what the impact on the burden of disease would be if we have achieved a 90% conversion rate to these things. Those are extremely optimistic assumptions. If they turn out not to be correct and it's lower, well, that means we've achieved something great, but not as great. But it's the possibility of achieving results using those figures that really puts the gleam in our eyes. So Richard Pito at Oxford has said that of the billion people who now smoke, we can expect half of them to die from it prematurely. But if the people who smoke who are under 40 quit, 90% of them will have risks that are comparable to non-smokers. And even at the age of 60, you reduce your risk by 25%. And that kind of improvement in prospects is very rare in public health or medicine. So it's really quite amazing. So let's compare it to some other things that are seen as great breakthroughs. About the same number of kids under 5 die every year as people who die of tobacco-related diseases, namely about 6 million. And of these, 25% can be attributed to pneumonia and diarrhea. So now we have an effective interventions that can prevent those deaths, and there's a global imperative to make these available as widely as possible through the Global Alliance on Vaccines and so on. And they've achieved fantastic things. So the successes in public health and reducing child mortality are one of the great stories of the 20th century and the early 21st. We can all be very, very happy about those. But if this were to reach its goals, it would dwarf those successes. And it's hard to, it's important to keep this in mind because it's the potential payoff that as I suggested with my Manhattan Project analogy, that drives all this stuff. How often does one find a concatenation of possible steps sort of lying around where you either have or think you could quickly have the knowledge that's needed and the technology that's needed, where the cost would be so low, in fact, the cost of this might actually be negative. It might actually pay more than it costs to do, and where the impact would be so huge. My colleagues at the School of Public Health are frenetically busy, each person with his or her own project, trying to find a vaccine for malaria, some way of preventing the rise of the obesity epidemic, vaccine for AIDS or a cure for AIDS, all these different things. But if you look at the potential payoff, if they reach their goals, and for many of them it's decades away, that would be decades away if it ever happens, this turns out to have a greater impact than almost all of those. And yet, the cost is negligible. All we sort of have to do is decide to do it if some of these positive assumptions of ours are borne out. And they don't seem that crazy. So this seems to be something very rare. It's just a matter of connecting some dots. The dots are all in our midst. Those who work in tobacco know all about them, have known about them for a long time. It's a question of focusing attention on what could be achieved, flipping the switch so that it's a question of how rather than whether, and then removing the present obstacles to achieving it, starting with the terrible split in the field. So let's see, how much, that's enough? So a little bit more? Okay. Well, I have a whole lot more, but I'm going to try to I'm going to skip about 2/3 of the remainder, but let me try to make sure that I mention a few things that I think are important, especially significant. So one argument for our proposal that we have used with some success with opponents, potential opponents, people who want to regulate the life out of these alternative devices, is the following. Those, mostly the sort of old guard in tobacco control, who want E-cigs and other nicotine devices regulated on a par with tobacco, they're the ones who've applauded WHO for what it's done so far in this regard. We think what they're doing is floating a message that they never quite say explicitly, that these devices are just as dangerous to the user as cigarettes are. Now, they don't say it, or rarely do they say it. They'll sometimes say, no one knows how dangerous they are, which is true. But if you take good faith estimates, that looks to be wildly false. If there is a consensus, and there isn't, but if there were to be, if you sort of average it out, expert opinion, a 95% reduction in risk would be in the ballpark for the average. So any intimation that science can tell you that you're not going to be able to reduce your risk by switching from cigarettes to these things is just an untruth. Now, the fact that it's not made explicit doesn't mean that the message isn't going through, and if the message is accepted and acted upon, it may be because people draw that conclusion from the fact that the public health people are so dead set against it. Now, is that a success or a failure? It's a success from one point of view. If you are somebody who's dedicated to the so-called end game in tobacco, what you want is that at a certain point, tobacco should be something we read about in a history book. There was a period in the life of civilizations when huge numbers of people use this product and it was legally sold and kill half of its customers when used as intended. And it was the most glaring loophole to every product safety law and regulation that ever could be imagined. And even after other products became heavily regulated and any risk caused a big slap, here this product that was killing half of its customers who used it as directed was continued to be sold legally. Amazing story of human perversity. Okay, so, but that was then, you know. Now today, we're talking about 2600 or something. You know, today, of course, that would never happen. That's what they want to see. And the way they wanted to achieve that is this. The tobacco industry has succeeded over the last several decades by two tactics, mainly. The first one is, as its buying public sickens and dies prematurely, it's replenished. It's replenished because people take up the tobacco habit before their brains are fully formed. The part of the brain that comes in last is the part that allows you to take what happens to you in the future seriously and give it proper weight. So very few people are dumb enough after age 25 to get addicted to tobacco. What they count on is people who are not yet adult, really. And as long as enough of them can be reached with tobacco products and be addicted, then there'll be a never-ending stream. So the strategy is to focus on those very adolescent potential buyers. And if you can keep them away from cigarettes, the cohort of addicted citizens will age, and eventually it will die, and that's when tobacco's history. So that's the whole idea. How do you do that? You denormalize smoking. So it used to be that only everybody was exposed in the movies to these suave people who smoked cigarettes with holders, and they were all beautiful and so on. Now the image of the tobacco smoker is some kind of funny-looking dude outside of a factory or office building in the snow, trying to get his hit before he goes back in, and it's not attractive at all. And we could do more in that regard, but it's been extremely effective in the United States. So there's been success. Unfortunately, because of the other tactic of the industry, which is to move a promotion basically out of the countries that have wised up into the unregulated countries, or the countries where they can push officials around, they look to the third world as the source of growth, and that's why the numbers of smokers go up every year. So it's a plague in places where there aren't too many people who write about this and who we know and talk to. So we can have the feeling that tobacco is basically a battle that has been won, essentially. It's just a matter of cleaning up for the last act. But elsewhere, it's really just getting going. So the industry, for a long time, had another tactic, which was try to confuse the public about whether smoking was all that dangerous. Now, we know now, as many of you are aware, that the tobacco industry was perfectly aware of the health risks of tobacco as soon as anybody knew. They were among the first to know. And they were intent on keeping it a secret. We now can look into their files thanks to a funny thing that happened in litigation, and we see all this correspondence about, yes, what we sell is a machine to addict people, and it kills them, period. And how we must make sure the public doesn't ever know this. It took a while. Okay, so that they did it for a long time, and they contributed huge amounts of money to anybody who could conceivably help spread the word that although there's maybe some evidence that smoking is dangerous, and there are some scientists who believe that, also there's scientists who believe the opposite. For those of you who don't know this story and want to read about one of the most horrifying public relations campaigns in history, there are two magnificent books, one called Cigarette Century by Alan Brandt, colleague at Harvard, and another one called The Golden Holocaust by Robert Proctor at Stanford, and they tell the whole story. Now, what they were doing is they're kicking sand in the eyes of the public, trying to confuse people about what science said, and they really took this about as far as they could go. They created organizations whose ostensible purpose was to combat bad science. And of course, what they were trying to do was to undermine the authority of people who did good science. So spreading doubt in the public about whether scientists really knew what they were talking about when they said the smoking was dangerous, that was their main goal. So doubt was their product. There's a recent book by that title. Another one is Merchants of Doubt by Conway and Ecigs, which is a fantastic study of this. What the smoking industry did spread to other industries. So Exxon has been pouring huge amounts of money into these fake grassroots organizations like the Heartland Institute that are dedicated to confusing the public, making the people in the public think that scientists are divided over whether or not humans are contributing to climate change or that climate change is actually occurring. And the same thing happened with the lead industry and on and on and on. So, and all this has been a threat to, first of all, to science, because science is losing the trust of the public, but of course eventually and directly to public health, because scientists say, we now know that you shouldn't do this or you should do that in order to avoid dying, but the public says, well, there are two sides, aren't there? There are a lot of people who think the opposite in science, and anyway, you're just going to get your grants renewed, aren't you? Now, what do people in public health and allied disciplines have on their side? How can they fight back? The evidence. The only thing we have is the evidence. We can say, look, if you'll take the trouble to read the journals and to acquaint yourself with the science, you'll come to the same conclusion. We're not asking you to take our word. We're just asking you to look at the facts. And if we give that up, we got nothing. Now, what's going on in the tobacco wars right now with the E-cigs, I fear, and others have voiced similar concerns, is that for the very first time, the good guys, the science people, are essentially indulging in some of the same kind of hint, hint, nudge, nudge suggestion of things that the science does not back up. Saying things that they know will plant the thought in the minds of many people in the public that e-cigarettes are known to be as dangerous as cigarettes. That's why they should be regulated. When actually the scientists don't think that that's true, or it's not true enough to warrant that kind of regulation. So why do they want the regulation? Because that's the chosen vehicle for making tobacco history. That's how you do it. You regulate the hell out of tobacco, you try to prevent addiction, and eventually the cohort of addicted people will age, die, and that'll be the end of tobacco. So it's the fear of giving up on this grand strategy that has worked so well in the richer countries. That seems insane after all these victories over the last decades. And it seems to me that pretty clear that's, if you want to know why these proposals for encouraging the use of these things create such a fierce opposition from people who've spent their lives trying to free mankind of the burden of tobacco, that has to be the explanation. So that accounts for the passions on that side. And I'm afraid that in my mind, that this point about playing with fire by sort of joining the types of people who confuse the public about what the science is, this really is something that we shouldn't get near. So what causes the passions on the other side? Several things. Part of it is, I think, the one that drives us, which is this picture that we could achieve an incredible reduction in global burden of disease using what we already know at negligible cost. The idea that is possible sort of makes you giddy. But a second thing is driving it, I think. The tobacco companies were, along with their other efforts at confusing the public, also created what we call in the States AstroTurf organizations. AstroTurf was a fake grass lawn that was used in indoor stadium. So that's they look like grassroots organizations, but every one of them turned out to be created by the industry. But with e-cigarettes, there are genuine ones. And they are created and run by people who liberated themselves from tobacco by using e-cigs. And many of them are extremely passionate about this. They think that they were liberated from certain, 50% chance of dying prematurely, and they want to spread the good news, and they are intensely frustrated when people who claim to be protecting the public from tobacco try to slam the door in their face, and who float these messages that they think are disingenuous and untrue. So you get passion on both sides. Well, we hope we can get past that, and maybe if I've convinced you, that'd be great. We'll sign you up. Well, we want, now let's just spin out the fantasy, shall we? So what we'd like to do is to create some pilot programs, a county here, a district there, at several different levels of development. We're hoping, like in China, and ranging from China in the middle class down to some very poor nations, but also advanced ones. And this would give us a laboratory to try out all kinds of variations with all the steps that have to be done. If you could achieve successes like we're talking about there, then you can make the argument that it could happen anywhere. And for this to happen, we need a wide circle of people who think that this is a door that opens onto something absolutely unimaginably wonderful, and they want to be a part of it. So that's why I'm here. So last couple of remarks about big things. And then I'll quit. And actually, I think I've sort of covered a lot of this. I'll just end with this this big theme of this defect in our moral vision, which I don't think has been adequately explored by moral philosophers, and it's gotten a certain amount of attention by some of the psychologists who put heads of their research subjects in fMRI scanners and then ask them about trolleys. And it is there. It's a bias. It's a cognitive limitation. Now, in addition to preventing people from appreciating the magnitude of the harm visited by tobacco and the potential blessing that would be achieved if our proposal would be successful, there's another one, and that is, to my mind, this is something I have to work out in much more detail. It seems to me that if you think that how reprehensible an entity of some kind should be proportionate to the amount of harm that it willfully causes. Serial killers are worse than just one case killers, and mass murderers are worse than they are, and maybe proportionally. Now you have to discount for a whole bunch of things. Maybe they're crazy, so that makes that takes the intent down a little bit, and so on. But basically, there should be some proportionality. If we did all that, it seems to me, and we calculated everything properly, then the tobacco industry should be a total pariah. It shouldn't be. Right now in the United States, our school, no faculty member can accept a grant from a tobacco company, and it's the only industry that has a ban on it like that. Harvard won't invest in tobacco, and trying to get Harvard to disinvest in Exxon is proving fruitless. So it is something of a pariah, but if someone says, I work for Philip Morris, they're not thrown out of a party. If they said I was a member of the Nazi Party, I think they would be. So maybe if we pursue this, correction of our moral vision, it's part of our project, we can help to make the industry and everybody who aids and abets it become that kind of pariah. So I'll stop there.